slow down. So you just saw Dr. Yadav last week, correct?
Correct.
Okay. And it looks like he's ordered quite a few scans and the port. Have we had any of that done?
Nothing's done. Everything's scheduled for next week.
For next week?
Yes.
Okay.
This week.
I mean, this week.
This week.
Yeah.
Okay.
I'm already in this week.
The echo as well? That's the
that,
ultrasound of the heart?
Yes.
That'll be tomorrow.
That's,
okay.
Yes, on Tuesday afternoon.
Good. So we'll be doing a CAT scan, an echo, a bone scan, a brain MRI, a PET scan, and then getting the port placed.
Right. The PET, they called, and they couldn't schedule it until next Friday the 1st.
Okay.
Because it has to be done after all the scans and stuff
Right.
are done.
Okay.
So they couldn't do it.
Okay. I'll check with Dr. Yadav to see if I imagine he'll still want to start the chemo without that. As long as we have the baseline CAT scans, it's probably not going to change the treatment, but we kind of like to have a baseline. So I'll check with him to make sure he wants to start. I anticipate that he will. And did he give you a lab slip last week to have blood work done?
Yep, that's all done.
Okay, good. So that'll be your baseline set of labs for the first treatment. We will do labs weekly during treatment.
Okay.
So if he didn't give you a standing order for blood work, which I don't think he did, I'll give you one today.
Okay.
So he's probably going to want to see you back on the day of treatment, on the day of first treatment, to go over all of the scans before we start. We can't start the chemo until we have the echocardiogram. And the reason is, so the echocardiogram is measuring your heart function and how well it's beating with each contraction. It reports what's called the ejection fraction, and we want it to be greater than 50%. So we would not start the chemo if it was less than 50%. And then we can repeat that down the road if need be. But the first drug that you're going to be getting is called adriamycin.
Right.
And did you get handouts on it?
I did.
Good. So that's in combination with Cytoxin. So that regimen is given every other week for a total of 4 cycles.
Right.
So that process takes about 8 weeks, but it's only 4 treatments that you're getting.
Okay.
So again, weekly labs throughout that time, but just 4 treatments.
Okay.
So the adriamycin can sometimes be cardiotoxic, rarely, but that's why we check the echocardiogram before that to make sure that you have a healthy heart. And then we'll be checking things, during your follow-ups, like your blood pressure, making sure you're not having any increasing shortness of breath, swelling in your legs, things like that would concern us that your heart wasn't pumping like it should. So the adriamycin and the Cytoxin are the first, that's the first round of chemo. After that's complete, you'll get a 2-week break. You'll still get labs during that time, so it's not a big break.
Okay.
And then we'll be doing Taxol, which is weekly, for a total of 12 weeks.
Okay.
So typically, the Taxol is a little bit easier to tolerate than the first round of chemo. It's nice because it's just an hour an infusion once a week. We still do the weekly labs, but usually patients do pretty well with it. So with the adriamycin and the Cytoxin, we can see some suppression of the blood counts. And the reason that is the way chemotherapy works is that it kills any rapidly dividing cell in our body. So the cancer cells are number one. They grow and divide very rapidly. But unfortunately, it doesn't discriminate between our normal cells. So that's why we get all these side effects. So the hair cells grow and divide rapidly. That's why we can lose our hair. The blood cells grow and divide rapidly. So red cells, white cells, and platelets. That's why we watch those once a week. The cells lining our GI tract, so inside our mouth all the way down, those grow and divide rapidly, so sometimes patients can get mouth sores or a sore throat. So we'll be giving you a medication to help with that, which I'll talk about. So with the adriamycin and the Cytoxin, the most common side effects that I see, in addition to the suppression of the blood cells, are nausea, sometimes vomiting, fatigue, and then GI complaints, so diarrhea and or constipation. So we'll be giving you a nausea medication. I think they're actually here for you today. It's called Compazine. It can be taken every 4 hours as needed. I do recommend that you take it with the first wave of nausea, not when you're about to be sick, because if you take it when you're about to be sick, you might throw it up. Right. So If you're taking that every 4 hours and it's not doing anything for you, we need to know, because we'll need to adjust medications or add additional medications. We will be giving you a shot of, it's called Neulasta. Did Dr. Yadav talk with you about that?
Yeah.
Just with these first 4 treatments, it's the day after the chemo. So you just come in, you don't really need to see the doctors or the nurses, you just see Jackie or Danielle get the shot and go home. And that's helping to stimulate white blood cell production.
Wow.
So we're not giving you white blood cells, we're stimulating your own bone marrow to produce blood cells. Sometimes patients can complain of some body aches with that shot, so there's a medication on here. We haven't called it in yet, but I was going to give it to you. It's called Claritin. I'm sure you've heard of it for allergies.
Yeah.
For whatever reason, there have been some case studies that have shown that it can help with some of the body aches associated with the Neulasta. A lot of patients describe these aches as like growing pains, that you would get in your legs, but kind of everywhere. It can be pretty bad in the hips. So some patients get them pretty badly, some patients don't get them at all. If you do get them, usually it happens anywhere from 24 to 48 hours after the shot, and patients will wake up one morning and everybody kind of tells me the same thing. They say, I feel like I was hit by a truck.
Yeah.
So almost like you have the flu kind of, you just hurt everywhere. So the Claritin can kind of help. You can take it the night before the shot, the day of, and the day after. So that we don't have at our pharmacy. And same with the Magic mouthwash. That's to help with the mouth sores if you get them. So I'll give this to you guys, and you can fill these if you need to.
Okay.
The other medications, which we should have here for you, all of our patients who get chemotherapy get an antibiotic. This is only to be taken if we tell you. So this one you just kind of set aside. We reserve it for infections, fevers, greater than 100.5 is usually our cutoff, or low blood counts. So if we get your labs one day and we see that your white count is low, we will call you. So just kind of push that one aside.
Okay.
And then the Compazine is a nausea medication we told you about. Let's see what else they called in for you. Usually everybody gets Prilosec, which is to help protect your stomach. Are you on anything like that?
No.
No? Okay. Yeah, they've called that in. And your antibiotic is probably, since you're allergic to penicillin, it's probably a Z-Pak. Yes.
Okay.
So that's the antibiotic that you'll just put aside. So Prilosec is to protect the stomach, and the nausea medication is Compazine to help if you should need that. I'll have to see if there's Decadron. Some of our patients get Decadron just initially for the first few days after chemo with these first 4 rounds to help with the nausea, but he didn't write that for you, so I'll see if he wants that. What else can we talk about? So we did talk about labs once a week. We usually see you on the treatment days, so you're coming in every 2 weeks. Sometimes we'll get you started back there and then have you see either myself or Dr. Yadav just to see how things are going. But if you need us on those off weeks, by all means, please call us. There's somebody on call all the time here.
Okay.
This is the most common regimen given to breast cancer patients. So we see a lot of breast cancer patients. The nurses are very familiar with giving the drugs and very familiar with the side effects of the drugs. What I can tell you is that usually by the 3rd or 4th cycle of this, patients feel a little crummy. So I would just kind of anticipate, usually the side effects are pretty predictable with each cycle. They just get a little worse, and sometimes they're stretched out for a longer period of time. So if you're feeling dehydrated, if you're either really constipated or having tons of diarrhea, feel like you're getting dehydrated, just let us know. We bring in patients for fluids all the time. As far as nutrition is concerned, the chemo can change the taste buds in your mouth. I'm sure you've read about that. So foods may not taste the same. You have to kind of experiment with different types of things, different flavors. You're probably not going to be able to sit down and eat a whole big meal at once, so just small, frequent meals throughout the day. There are really no dietary restrictions other than grapefruit juice we don't recommend. But just kind of be careful with fresh fruits and vegetables that you're washing them really well. If you're eating out, maybe stay away from the salad bars, or if you're not sure who's touched what. If you're feeling poorly, your immune system's probably down, so you just have to kind of be careful. But you may read on the internet that you can't eat fresh fruits and vegetables. That's not true. You just have to wash them very well.
Okay.
A lot of patients ask, okay, I know what I can't eat, what can I eat, or what should I be eating? And it's really whatever you want. You know, I wouldn't sustain yourself on McDonald's.
Yeah,
But sometimes if that's all you can get in a day, you know, you need calories. Lots of protein is helpful. If you're really running into a problem, getting nutrition boost, Ensure, Carnation Instant Breakfast, anything, you get a lot of bang for your buck in those little bottles.
Yeah.
We have samples back there and coupons, so don't go out and buy any until you know if you like them, because they're expensive. But you'll just have to kind of try different things. Also, to tell you, which I tell all of my breast cancer patients getting this regimen, this is not Weight Watchers.
Yeah.
So if you don't lose weight, do not be sad. Sometimes